Have you or do you know someone who's been suffering with low back pain, maybe for a short while, or maybe for like a long time, many years? Well, the funny thing is that when most people have back pain, they often get really concerned, really stressed, really worried, and quite rightly so, because something is not right. So what they do is they'll often ask friends or family for some tips or advice, or they might look on Google and they'll check and see what's going on and see if they can kind of self-diagnose from that point of view. However, the very best thing you can do before you get anything complicated or get anything wrong is to go and seek professional advice. Hi, I'm Trishul. I'm an osteopath and a chiropractor based in London in the UK, and I'm one of 3 people qualified in both these professions. And today I'm going to tell you exactly what you should do if you get into trouble and you can't quite get to the root cause of what you need to do. Now, first of all, we see thousands of patients here every year who suffer with low back pain or some sort of aches and pains. And often they say, "Oh, Trishul, I've tried everything. I don't know how to fix this problem." And I'll go through their case history. I'll ask them questions about what's been going on, what they've been up to, what the cause of it could be. And they'll say things like, "Well, I've tried this, I've tried painkillers, I've tried heat, I've tried ice, I've tried this exercise that somebody gave me, I checked this, that, the other." And they're kind of getting so confused and muddled, and their body's getting worse and worse and worse. And they're getting to a state where they're so stressed that they can't get their problem fixed. We also get some people who get really worried about actually seeking professional advice, because what if it could become a horrible diagnosis and they will then know about it and then they don't know what to do next and they get really stressed out too. But hang on, wouldn't that diagnosis happen anyway, even if it's informally, because their condition's in that state? So it's better to go and seek professional advice and get a diagnosis anyway, so we can at least get the problem fixed. And so the prognosis, meaning how well and how quickly we can resolve the problem, is going to be much higher for you. But here's the thing. I've been speaking to people recently. Somebody said, "Oh, do you know what? I've been taking all these painkillers." Well, the thing is that painkillers are not the problem. I mean, I don't know anyone who I've ever met who has a deficiency in any type of painkiller. So that's certainly not the option that we really ideally want to go for. Maybe for the short term, but certainly not as a long-term solution. However, I meet so many people who have been taking painkillers for several years and not really had the problem fixed. Or you might have people say, "Oh, I've been doing these exercises, I've been doing these things, and nothing's been out of the ordinary. And suddenly all I did was I got up and bang, or I was doing, carrying out my daily tasks and bang, something happened." Well, those are situations where it's a little bit like where they've been doing things gradually day in, day out without realizing there's a problem occurring, because they haven't been going in for regular checkups to make sure everything's working properly. I mean, we check everything else regularly, don't we? For example, just in healthcare, we check our teeth regularly, we get our eyes checked, we get our blood pressure checked, or even non-medically, non-healthcare wise, we get our cars checked. I think a lot of people look after their cars better than look after their own bodies. So you get it serviced regularly, you get it MOT'd regularly, you check the air pressure, you check the tires, you check the oil in the engine. Or maybe, for example, you might even check your boiler for your central heating on a regular basis, get that service on a regular basis. And we know that it's important to do because it helps prevent problems occurring. If a problem was to occur, chances are it's going to be a lot simpler, a lot cheaper, a lot quicker, a lot easier to fix. And we know that it's going to be the best thing in the long term to make sure we get the longevity out of that. Well, why don't we just do that for our bodies too? I mean, it just makes sense, doesn't it? So we need to find the root cause of the problem. Now, the way we do that is we make sure that when you go to a professional, they can't just start clicking, cracking, doing massage, working on areas just blanketly. The reason is because that's not going to be finding the root cause. Let's say, for example, you went to a surgeon and he said, "Hey, I've got this aches and pains." You would not expect that surgeon to say, "Great, hop onto the surgery table and we'll start performing surgery," without a full consultation, without a full examination, without thorough analysis of those results and find the root cause of what's going on. You would not expect that of a surgeon, or even maybe another physician who prescribes you some tablets. You wouldn't expect them to just dish out some tablets because they wouldn't know which ones to dish out to you. Same way with this. We want to make sure with your chiropractic and osteopathy, the reason why the professional, your healthcare professional, goes through a full case history, goes through a full examination to find out the root cause of the problem. First, to make sure we've got an accurate diagnosis. Secondly, if you are suitable for treatment, because we've got to make sure we do the safety checks. And thirdly, to make sure we've applied the appropriate and effective techniques and treatments for you. So if you've got any questions about this, please do leave me a comment, send me a message. I'll be happy to answer any of them on any of my social media channels, particularly Trishul that goes directly to me. I hope you found this video useful and look forward to seeing you in the next one.